Hi, my name is Dr. Zubair Bagassi, the CEO of the Synergy Dental Group, as well as the Clinical Director of the Syntrain International Dental Academy. In this short presentation, I'll be giving you an introduction on our PG diploma in implant and restorative dentistry. It is a level 7 course accredited by Eduqual. The learning outcomes of this course is to enable dentists to develop their knowledge and understanding of both restorative and implant dentistry from a theoretical and a practical perspective. It allows you to progress your knowledge through the fundamentals of implant dentistry and understanding the principles of restoration in implant dentistry through the straightforward, advanced and the complex classification, the SAC classification, as it's known as, developed by the ITI. The course also allows you to be confident in the ability to identify cases which are outside the scope of your practice and the ability to refer these cases out. Furthermore, it allows existing implant surgeons to further their knowledge and skill in implant dentistry from moving from the simple and the straightforward classification to the more advanced and the complex categories. It allows learners to understand the principles of both the analog and the digital workflows, and most importantly, able to independently place implants from single units to full arch implant dentistry. The course is designed using the principles of tell, show, do. I'm a very firm believer of that because once you are told what to do and you've understood the actual theoretical knowledge behind any part of your clinical dentistry, you are then shown the actual procedures, and then you're able to implement that practice and learning in actual clinical practice. A quick outline of the course is that the course runs between 6 to 12 months depending on your speed of learning. It's a blended teaching approach. Most of the theoretical teaching is based online, so you can learn at your own pace. All our assessments are digitally based. We have digital meetings between the mentors and the mentees. There's research paper reviews that will be assessed on online as well. There's hands-on study days as well as an integrated both direct and indirect mentorship program which takes you through the full SAC classification and in compliance with the implant standards within implant training standards published by the Faculty of General Dental Practitioners. We also allow and offer support to new users to integrate dental implantology within their own practices. And further still, there is support available post-course completion. The actual mentorship that we offer is actually a GDC requirement as part of the training standards in implant dentistry. The Faculty of General Dental Practitioners have published this guideline and allows each and every implant user to be able to demonstrate that they not only have been studying within an accredited dental implant course, but have also been mentored appropriately through a structured process. Our course integrates this mentorship within the course curriculum. We guarantee at least 10 cases with hands-on experience. We provide the patients, and a mentor will be assigned as soon as the course starts. So as soon as you are enrolled within the course, we would assign a mentor to you. The mentors are available both for direct and indirect supervision. So as you are progressing through the curriculum from the straightforward implant dentistry to the advanced and to the full arch complex implant dentistry, you will be mentored all the way through. Mentors are also available 6 months post-course completion. So it allows you to integrate the implant dentistry within your own practices as well. Our course lecturers are the esteemed Dr. Anil Shrestha from Wimpole Street, specialist registered prosthodontist. Dr. Shakil Akhtar, who's a maxillofacial consultant. Myself. Dr. Wasif Jamil, who is an oral surgeon based in Lancashire, Dr. Karim Rashidi, Dr. Zuhaib Ali as another specialist prosthodontist, our award-winning Dr. Ali Altaf, Dr. Bilal Salim, as well as Dr. Nada Mudaris. It allows our team to be able to offer you not just the theoretical knowledge, but also support you through the full mentorship structure. The course is designed and broken up within 4 units. Unit 1 takes delegates through the fundamentals and principles of simple implants and restorative practice for dentists, whilst Unit 2 advances that initial learning and takes you onto a more advanced classification and widens your knowledge and skill within implant dentistry. Unit 3 then introduces the more complex implant dentistry principles and treatment plans, and Unit 4 builds on Unit 3 for allowing delegates to learn about full arch implant dentistry as well. So it's a very structured approach, allowing our learners to progress slowly through the actual course. The structure for Unit 1 starts off with detailed theoretical learning on assessment and treatment planning, which includes the history and examination, followed on by treatment planning, and then the principles of consent, which is an extremely important aspect to any implant course. The fabrication of the surgical drill template, so this all in preparation for the implant surgery. It takes you through history and assessments, teaches you about the simple implant procedures, and allows you to actually physically place your first implants. Delegates are then enrolled onto Unit 2, which advances the learning that you have been delivered in Unit 1, and then takes your knowledge, widens your knowledge into more advanced dental implant procedures. All still very structured with very close help with your clinical mentors as well. The course is structured in similar modules, taking you through the assessment and treatment planning for a more advanced case, the consent procedures, the fabrication of the surgical templates, the full surgical procedures for an advanced implant dentistry case, from initial osteotomy to CT planning to suture placements, all the way through to the restorative elements of implant dentistry for an advanced case. It then finishes off with aftercare and maintenance, which is key for long-term success for any implant treatment that you deliver. In summary, Unit 2 builds the knowledge from Units 1 and advances your skill and experience to be able to understand and have hands-on experience into advanced dental implantology. Unit 3 takes delegates through the exact same pathway of learning from assessment and treatment planning to surgical procedures to prosthetic procedures and the aftercare and maintenance, but for more complex implant dentistry cases. Mentees are closely supervised by mentors to allow them to answer any questions that they may have, and the ability to call upon both directly and indirectly the mentors that are assigned to you. It allows delegates to learn and understand about complex dental implantology under a supervised and a structured and a safe environment. It allows you to understand the principles and the practical planning and the implementation and the experience for full arch removable overdentures. This brings on quite nicely to Unit 4, which includes, again, a very similar structure from assessment and treatment planning to surgical procedures, prosthetic procedures and aftercare, but related to full arch implant dentistry. So this is the all-on-6, all-on-4 type procedures where you are planning a fixed hybrid bridge, whether the patient has had existing teeth or whether the patient's had no teeth present, and clearly this is the more complex part of implant dentistry. So once delegates have completed and have passed the assessments from Units 1, they'll move on to Unit 2. Once they've completed the assessments and the mentorship for Unit 2, they'll move on to Unit 3. And once they've completed the Unit 3 assessments and the mentorship, they'll move on to Unit 4. And now this gives an implant surgeon the breadth and depth of knowledge, as well as the time and the time that's required to reflect on their learning and meet the learning outcomes. So Unit 4 includes the complex dental implantology, namely the full arch fixed implant surgery. The assessments are divided into both formative assessments and a summative assessment. The formative assessments are multiple choice questions after each module done digitally, but doesn't count towards the overall pass and fail mark, but you must pass this to move on to the next module. The summative assessment is the short answer questions that are based online, the multiple choice questions, the case studies that you'll be able to prepare, that you'll need to prepare. And these are after each of the units. Once you have completed your assessments after each unit and you have passed these assessments, you will then be enrolled onto the next units. It allows you to reflect and widen your knowledge and fill any gaps that you may have still had to be able to progress onto the next stage. Units 1, 2, 3 and 4 have a combination of both MCQs and short answer questions. On Unit 4, you'll then be presenting your final case presentation. Once you've completed Unit 1 and 2, you can exit the course on a postgraduate certification in implant and restorative dentistry, and this is at level 7. If you continue, then you would complete Units 3 and 4, and you would be awarded a postgraduate diploma in implants and restorative dentistry, again at level 7. This is an unique opportunity for individuals to be able to start their journey in implant dentistry under a very closely supervised, structured and well organized implants experienced environments.